Madam Speaker, thank you so much for spending time with dLife today. As we're talking about embryonic stem cell research and how important that is to the diabetes community, are you personally disappointed that this has become a political issue?
Well, it isn't a partisan issue. Republicans and Democrats support embryonic stem cell research. Just the President of the United States has not gotten to that place yet. But I pray that he will, because it's really so important to giving hope to America's families.
Given that he has promised to veto the bill, why has it become an important part of your first 100-hour initiative, knowing that what the outcome is going to be?
We had a strong bipartisan vote on our embryonic stem cell research bill. We can't be successful with any of this without the support of the outside community. And I'm ever hopeful that the President will one day hear that message. So we had a strong vote. We'll have a strong bipartisan vote in the United States Senate. We'll go to conference. Perhaps we can engage the administration in saying, what clarification do you need?
Right.
And it might be something the President can sign. If it doesn't, then we'll come back and see if we can override the veto. But that will take a strong outside mobilization.
Do you think the tide is turning out there in the general population and the people that are impacted by chronic diseases? I know I expected it to become a bigger part of the Democratic platform in the last presidential election.
I think the American people are well ahead of Washington, D.C. on this issue, as strong as our support is for it. Every family knows that they're one phone call or one diagnosis away from needing what stem cell research can yield for us. I served for years on the Committee of Jurisdiction that funded the National Institutes of Health, and I know what we heard from families of children with diabetes, for example, that they'll do anything.
Right.
They'll do anything to help.
It's a very passionate group of people, and as anyone that's suffering from a chronic disease, when you're impacted personally, then you can really mobilize. Do you think that inside the Beltway here, that Washington is really in touch with the kind of crisis we're dealing with in diabetes as an epidemic in America?
Surprising as it may seem, as much as we fight for funding at the National Institutes of Health, one place where there has been a very major focus of funding is at the Department of Defense because of Mr. Jack Murtha. He has made diabetes a high priority. In past years, he's done HIV/AIDS, breast cancer, prostate cancer. And now, for the past few years, diabetes has been his focus to use. Well, the Defense Department has resources, so we want to go where the resources are and make sure the research is being done.
I know the Diabetes Caucus, I think it's the largest caucus on the Hill.
I wouldn't be surprised.
Yeah. You mentioned before trying to reach across the table to the President. Are there any specific ideas on how to bring everyone together to try and find a way to advance this cause, and rather than just debating on different sides of the issue?
Well, we want to be very respectful of those who disagree with us and convince them that part of all of this is God's gift. Science can answer our prayers. So this isn't about being religious or not, which they've tried to make it that kind of issue. This is about respecting the gifts that God has given us to solve our problem.
What more could we do to help so that their voices are heard?
I don't think there's anything more eloquent to a member of Congress than the voice of his or her own constituents. So these people, the folks that you work with, should be talking to their member of Congress, telling them their personal stories and how this will affect them, and how they are people of values. They're values-based in how they approach things, and they consider this power to cure an important source of hope for their families. They also, as you have been doing, continue to create a drumbeat across America, even if their member of Congress is okay on the issue, to continue to keep that drumbeat going, that echo chamber of support for this until the policy is changed and families have more hope.
America lags the world significantly. 14 other countries serve chronic diseases better versus acute conditions. Do you see anything happening that can really affect change in our healthcare system?
It certainly is necessary for us to affect change in our healthcare system. And and the insurance of it.
Yes.
We're not talking about the delivery of services from the government. We're talking about leadership to have public, private, individual initiatives to ensure universal access to quality health care. This is essential in an issue like diabetes because the preventative the earlier interventions can be so helpful in preventing diabetes. The diets of our children, and of all age groups, but particularly our children, can be impacted if we act earlier.
Absolutely.
So that's what we would hope to do. And you know that there are disparities in health, whether it's diabetes or whatever, from one racial group to the next. So again, the eating habits, diet, exercise, whatever it happens to be, the earlier the intervention, the better it is. And if you're not in the healthcare loop, then you don't really know these things. So we want to bring more people into the loop by access to universal health care.
You sound very sensitive to it, I'm sure, through your constituents, but have you been personally touched by chronic conditions in your family or in other ways that really brought it closer to home for you?
Well, I think all of us, and I would say on the floor of the House, that every member of Congress, either family or friends, see a situation that could be dramatically different if we had faith in science and would move forward in a direction that is ethically based, very ethically sound, but hopeful about what science can bring to us.
Right. Do you see this issue becoming part of the Democratic platform in the next national election?
Well, we hope that this issue of embryonic stem cell research might be resolved before then. I have not given up on the president. I think that the more the American people speak out on this issue, the better our prospects are for the change we need. So I'll take it one step at a time and say we introduced this bill in the first 100 hours of the Congress because it was a priority for us, because it was a priority for the American people. It's relevant to their lives. And we will continue to make that case until we make that change. If need be, of course, it will be part of a national campaign for president, but we hope to resolve it before then.
Is there anything you want to tell our audience before we close?
I have followed the diabetes issue for a long time, and I do know this, that where there is scientific opportunity, we have a moral responsibility to place our resources. Diabetes takes far too much of a toll personally in the lives of people, on their families, and indeed on our country. And again, I think we have a moral responsibility to seek out the science where we see the scientific opportunity to fund it, give hope to the American people.
Thank you so much, Madam Speaker. We really appreciate you bringing your voice to this important issue.